Meanwhile, the United States of America has promised to collaborate with Nigeria in containing the spread of Ebola virus in the country. After a meeting with Nigeria's Minister of Health in Abuja, U.S. Ambassador to Nigeria, James Entwistle, said that the U.S. has pledged its total cooperation with the Nigerian government on the issue. Professor Chukwu used the occasion to clarify on the use of the Nano Silver drug for Ebola treatment, which has been temporarily suspended for now.
I was in the room in Washington when Vice President Biden and President Jonathan talked about the Ebola crisis, talked about our partnership, and pledged total cooperation between your government and my government on this issue. So I just came over to see the minister this morning to talk to him about that. The Emergency Operations Center, I understand, is working well. The isolation ward, I understand, is working well. So this is an example where we just have to, as part of the broad partnership between our two countries, we have to just keep collaborating and cooperating and working hard. That's what I came over to talk to the minister about.
We took delivery of these drugs from the Nigerian scientists on that Thursday, much later in the day, in Lagos, and handed it over to the incident management team in Lagos, and then started waiting for the consideration of the National Health Research Ethics Committee. They issued a preliminary no, that was on Friday, and in issuing a preliminary no, I said the reason was that they still needed more information, which we asked the scientists to provide them. And then on Saturday, early by 5 a.m., they told me, well, that it didn't pass the standards in our National Health Research Ethics Code. So I then didn't approve. So no patient has received it. But the bottom line is that we're not using it since it did not pass through the National Health Research Ethics Committee.